Home, a nonprofit assisted living community. A family makes a house a home, and we value your family like our own. With all-inclusive rates and an experienced care team, you'll feel right at home. Call today to schedule a tour.
If you are a woman over 40 and haven't yet gotten a mammogram, our next guests encourage you to not put it off any longer. Doctors Jeremy and Jermaine Hogstrom are back with CHI Memorial Internal Medicine Associates, and their message is to go ahead and get screened. Good to see you both.
Thanks for having us.
Do I have it right? 40?
40, depending on the guidelines. So some schools will say 40, some will say 45.
Okay. Go ahead.
Yeah, but actually more recently now, a lot of your baseline screenings will start at 35, simply due to the fact that there's more increasing rates of cancer among younger women. And again, as we always say, early detection is key for that.
We are seeing that. I mean, I know October is Breast Cancer Awareness Month, thus
Right.
our conversation this morning, but it does seem like in just casual conversation, you hear about it striking women at younger and younger ages. I mean, I know you are both internal medicine doctors, you're not oncologists.
True.
But can women come to you in your practice and still get that initial screening from you?
Absolutely, and we highly encourage it. You know, our focus is primary care and primary prevention. So we're always talking about screenings, we're always talking about ways to better your health, and breast cancer screening is one of those things that we do bring up.
I guess it's frightening for a lot of women because these earlier diagnoses are happening, and sometimes there's not a history of it, Jeremy, in the family.
Correct. So there may not always be a history, but there can still be risk factors that can increase your risk for breast cancer, right? And so we want to talk about things like alcohol. There's more and more data coming out about alcohol being a risk factor for increasing your risk for breast cancer. Of course, smoking. And of course, there's other environmental factors too. But with that being said, if you do have a family history of breast cancer, that again would be a very, very clear sign that you need to get screened, and oftentimes at the earlier age.
We live, Jermaine, in a society, I guess, of specialists in the medical field, and that's great.
Yes.
But y'all are kind of like the quarterback of the team in a way, right?
Yes, we're the ones that they will go to initially for any problem, any concern, and so whenever they come to us, that's really their first foot in the door to addressing those concerns.
So, okay, as the relationship, the doctor-patient relationship in
Yes.
internal medicine, in a good situation, it's just kind of the annual visit, right? That's
Correct.
the hope.
Correct. That's the hope. That is the hope, man, because again, the annual visit is usually targeted for a preventative, to cover all of your preventative measures. And so it's really to hold both the patient and the physician accountable, saying, hey, we've covered these things, and to answer any questions that you have. And so what I tell a lot of people is we don't have to wait even for that annual visit to even start discussing all the preventative measures.
Right.
So even anytime throughout the year, we can say, hey, have you gone for your breast cancer screening? And if you haven't, then we're going to have that conversation. And then by the time we get to your preventative visit, we've already covered that.
Communication's the key to everything, I guess,
Absolutely.
in life. So here often we'll do interviews, the camera will be off, and then the good stuff comes out, right?
Yes.
And when the camera's up and rolling, you find out all this information that you wish you had known. So in the office setting with you, is the way you talk to your patients and your patients share with you key to you getting them the success they're looking for?
It is, and one thing I do, I always want my patients to be very open with me about their concerns, which is kind of going back to what you were saying, really building that close relationship with them. And once you're able to do that, they're able to trust you, they're able to trust what you recommend, which oftentimes leads to them getting their screenings and catching things early.
Back to the screenings then, on the mammography side, y'all are affiliated with CHI Memorial.
Correct.
So if a woman comes to you and she wants to schedule that mammogram, will she do it there at your location? Will she go to the Mary Ellen Locher Breast Center? How
Correct.
will that work?
Yeah, so we will oftentimes send them to the Mary Ellen Locher Breast Cancer Center for screenings, and they do screenings of all types, really, but they really have an extensive approach when it comes to breast cancer screening, and the way that they communicate to the patient and back to us is very, very good. Whenever any positive findings or any abnormal findings have come about on screenings, they're quick to inform the patient and get them back in for follow-up.
They are known for that team approach.
They are.
We highlight that often when they are here. So if the worst happens and something is detected, and now that team of specialists at that Mary Ellen Locher is watching. Y'all still are going to be kept in the loop as the primary care?
We will. And one thing I will say about them is that their approach I find is very unique. It's very all-encompassing. They really take the full patient, address every aspect of their life, and try to help them the best that they can. And so I really do appreciate that about them.
Are y'all accepting new patients?
We are. Absolutely.
Okay.
Always.
So here's where you will find them. Doctors Jeremy and Jermaine Hogstrom. They're part of CHI Memorial Internal Medicine Associates up on Hickson Pike. 875-0999 is their phone number, and they love to talk, so don't be bashful when you come in. Good to see you.
Thanks. Thank you.
Have you been injured due to someone else's negligence? Insurance companies have their experts trained to politely minimize your injuries and circumstances. With us, you'll have someone